At ALDER, people live here for a long time. We're a long-term stabilization unit, so people will be here for a lengthy time. So this is their home. And so we want people to be treated as if they're in their home, and for family members to feel like this is their own loved one's home as well.
We always look at when a person comes into care as to how can we get them back into the life that they had prior to admission. What we look at though is how a person changes and how whatever illness or disease process they have affects them. In this case, Matthew had a progressive brain disorder that was going to deteriorate potentially over time. We needed to determine how quickly that would happen, or whether or not, going back to his original life in Vancouver was even feasible.
He didn't have a long history in terms of needing tertiary level of care, and so he was a very unique case in that matter. He was young, he happened to have an illness, and where it affected him in the brain, allowed him to actually come to this unit as opposed to maybe getting treatment for his MS. It became quite quickly known that he most likely was not going to return to his former life. He wasn't going to return to his job, wasn't going to return to his apartment.
The vast majority of individuals with multiple sclerosis do not, at such a young age, become impacted so severely from a cognitive perspective, and also for Matthew, from a psychiatry perspective, also his emotional state. So the vast majority of young individuals do not get affected in this way.
Matthew had to go through that process of coming to terms with that in itself, and so we needed to support him in understanding that, and then starting to look at what next steps were available to him. Through many a conversation as a team, we looked at what were Matthew's needs and what he would need outside of hospital. And that's when we started looking at, is Vancouver the best place? And starting to engage with Matthew in those conversations, and also his family as to what did he want and what did they want to advocate for.
Also, since he was from Alberta, what can we do to reconnect him with his family, who were obviously a very excellent source of support for him?
Matthew's sister had also been diagnosed with MS shortly after he did. So the family had gone through a pretty big shock. Not only was Connie Sinasic dealing with Matthew in Vancouver, but she also had her daughter back in Calgary who had also been diagnosed with MS as well. Having the two incidents happen, or the two diagnoses pop up, really made her start wanting to look at potentially having both children back closer to home. Anytime that we're looking at aligning goals with any of our folks here, or the people that are in our care and their families or support networks, we start with just having initial engagement, just chatting, talking about what are the person's goals, what are their aspirations, and just getting a real sense of what do they want. And I think that follows within Providence Healthcare's patient and family-centered care approach, is trying to form alliances and relationships with the people in our care and their support network to try and determine what it is that that person wants.
Matthew himself is, pretty good about vocalizing sort of what he wanted to see happen for himself and where he saw himself going. So it was really sort of a collective team discussion that we had during rounds, and sort of incorporated into the care plan we had for Matthew was a goal of ultimately getting him home.
I just told him that I felt that I was able to go home, and they assessed me at that point, and then we just made the decision. I talked to my mom and said that I wanted to come home, and we just went from there.
So we had discussed as a team actually different ways on getting Matthew home and what would be sort of like safest means for him. Moving for anyone is stressful, and so we wanted to make sure it was a seamless process for him to get home. He did have a cat that was here in Vancouver as well, and he's flown before, and it can be a little bit more anxiety provoking than we would have wanted for him and he would have wanted for himself. We really just sort of all sat down, and then Malcolm said, I wonder if this is a possibility. Can I rent a car and can we drive him so the family doesn't have that extra stressor? They already have so much else going on. So
Malcolm had told me, actually he'd always talked all along about the possibility of him bringing Matt back to Alberta, and that we weren't to worry about it at all. And we were in a little bit of disbelief that somebody would, go to those lengths to to help Matt, but very grateful at the same time.
That was the decision that was made. And also I think was really important was that transition home. We know transitions are hard, but also for Malcolm to have an opportunity to meet with the family and talk about the care. And our team had already organized so much and really done a lot of work around it, but we wanted to have a package ready. We wanted to make sure that they understood what was going to be happening and not relying on just Matthew to communicate that. So we really wanted him to be engaged in his care as well as his family. And so having Malcolm go there was also able to help with that transition and also confirm all of the planning.
Picked up the SUV, drove it to Alder. We loaded up all of his stuff, and I cannot thank my team enough for the work that they did in doing the sort of the groundwork to get him all ready to go. Our care staff and nursing staff had prepared everything. Our social worker and pharmacist had worked so diligently on making sure that the follow-up plans were in place in Edmonton.
As a pharmacist, I have to make sure that they're on the right combination of drug, right dose, correct medications. They're not on something that they are not supposed to be. They're not experiencing side effect, simplify the medication, but hence they're on the right combination medications. And plus, when we send them home, make sure that they could afford the medication, because there's no point to send them home that they cannot afford the medications and they're not taking it, right? It doesn't make sense like that. So my job is to make sure that whatever I could apply special authorizations, whatever I could make arrangement, make sure that the pills is all covered, I would do that before they are discharged.
We certainly talked about, who we could connect him to when he's there for support services ongoing. So we just started to look into those options and see how we could continue to support him for continuity of care when he was back in, community. Because just because he's not, in our community here in Vancouver doesn't mean we shouldn't still have sort of wraparound services for him when he goes home, because we wanted to make sure it was a successful transition.
It was excellent. Malcolm was excellent. The trip went by very smoothly. I enjoyed the time. Malcolm was great. There were no hiccups. We made multiple stops for bathroom breaks and for food, but we got home within about 11 hours.
There's clearly a heck of a lot of love and support though in that family. They were incredibly welcoming for somebody that they really didn't know. Coming over to their house, they were incredibly hospitable towards me and obviously are just so caring about Matt. They had gone to great lengths to convert a room into a space for Matthew that was his own. Obviously, anybody would be very lucky to have that family as theirs.
We're very happy, and everybody that we've mentioned to it that this has happened, they're pretty much unbelievable that that level of service was provided to us.
It doesn't seem like it's above and beyond because we always try to do good care, and so I think that our team does it every day. I think sometimes it's just exceptionally amazing coordination when you do it from one province to another. That's where I think the above and beyond probably comes into place, but in terms of everyday care, I think we do that every day.
When we see someone discharged home, for example, or to a facility, it's like a pat of our back saying that, good job team, keep up with your good job. So I guess it means that we are on the right track, we're doing the right thing and keep up with our good job.
It's really given me the sense of how all the individual members of the team come together to support something different, somewhat atypical like this.
I think we all collectively really came together to really focus on how can we make this happen for this client and his family. And I'm just so proud to be part of a team that can really think outside of the box and go sort of outside of, I guess, normal ways of doing things to get creative and plan successful transitions for our clients.
For me, it's just doing what's right. I think that's just part of my nature, but also I think it's definitely the influence that Providence Healthcare has had on me. I think it's what our organization does. I think it's the right thing to do.